It's every parent's worst nightmare. Your child needs major surgery. But now imagine you live in a part of the world where doctors and hospitals are not equipped to treat the problem. Here is our Power Player of the Week.
Our motto is heal a child, change the world. These are amazing kids that they deserve as a basic human right to have access to advanced health care.
Susan Rickman is head of the World Pediatric Project, which sends medical teams to 12 countries in Central America and the Caribbean to treat children with serious health problems. 9 out of 10 people in the world have no access to surgical care. And when you look at the countries we work into, it's almost 10 out of 10 children that don't have access to pediatric care.
Get a prosthesis for that.
Doctors and nurses volunteer to spend a week treating as many kids as they can in their specialty.
The fibula there, and there's no tibia bone.
Fix the hurt, see what they sound like.
If it's an open heart surgery team that goes down, like to our Honduras, they do about 8 open heart surgeries in a week. If it's a plastic team going down, it may be 50 cases that they do by the weeks.
Doctors like Jeffrey Lukish, a pediatric surgeon at Children's National Health System in Washington, who's been volunteering for WPP for 7 years.
To go into an environment where children are so very needy and would be without surgical care and be chronically in pain, it is a wonderful experience.
But sometimes a child's problems are too serious to be treated in their country.
At the end of the week, they can look at a child and say, I couldn't do you here, but bringing you up to one of our fields in the United States, I can return you as a healthy child.
And it's a large atriocephaly defect.
McCall Hall from the island of St. Vincent was 12 years old when doctors saw him. He was flown to St. Louis to one of WPP's 17 partner hospitals to have open heart surgery that will let him lead a full life. You say the biggest challenge is to build trust in these countries. Why is that such a challenge?
Because I think there's been a lot of distrust earned in these countries with groups that have gone in and have not stayed.
WPP started in 2001, and the numbers are impressive. 55 medical teams travel to the region each year, treat some 2,500 children, and fly 100 more back to the U.S. Over the last 18 years, they've cared for 13,000 kids. The funding comes entirely from private donations, but that doesn't tell the full story. You raised $5 million last year, but you provided $25 million in services. How does that work?
Because of our doctors and our nurses, donating and giving of their times. We have medical supply companies that are giving us hundreds of thousands of dollars of supplies for us to take down with our surgical teams.
Susan Rickman has been part of WPP since the start. She says there's nothing she would rather do.
I think any time that you can look in a child's face that has been healed and you look at them and say, you are fine now, I can't imagine any better bottom line to work for.
Great, normal.